Welcome to the Genesis Nursing Continuing Education Series. My name is Denise Owens, and I am the Genesis Healthcare System Respiratory Education Consultant. I will be introducing you to and moderating today's subject matter, COPD Hits Home. This is the first volume in a 6-part series. As a Genesis employee or affiliate, you will have the opportunity to participate in free organization-developed curriculum for ONA credit. The objective of today's discussion will include defining COPD, state and regional COPD statistics, and how they relate to the Genesis service area. We will also learn how COPD differs from other lung diseases, the gold standard, and how a pulmonologist approaches COPD. We will discuss physiological and psychological impact of COPD, breakthroughs in pharmacological, surgical, and non-surgical advancements in COPD care. The nursing objectives will include the psychological approach to disease management and how to approach patients in an exacerbation, the multidisciplinary approach of care, and how to educate your COPD patient. I enjoy finding points of interest while researching to share with you during presentations. This is such a case. I looked at state populations through census reporting. The 3 states shown on slides are states number 48, number 49, and number 50 in U.S. population. Wyoming has a population of approximately 578,800, as Vermont has a population just over 645,000. Alaska is the largest state, it's about 14 times larger than Ohio. The 2021 census reported that Alaska's population is 734,182, and the population of Ohio is 11.78 million people. Ohio has over 11 more million people than Alaska. You're probably curious, why are state populations pertinent? The National Institute of Health, NIH, reported that in 2020, approximately 719,000 people in Ohio have COPD. Ohio has more people diagnosed with COPD that live in either Vermont or Wyoming. Ohio's COPD population matches the entire state population of Alaska. What is COPD? The Center of Disease Control says that chronic obstructive pulmonary disease, or COPD, refers to a group of diseases that cause airflow blockages and breathing-related problems. It includes emphysema and chronic bronchitis. The CDC reports that about 16 million Americans have COPD, and millions more have the disease but have not yet been diagnosed. Note the dark blue states on the CDC map. The respondents answered yes to: has your doctor or nurse or other health professional ever told you you have COPD, emphysema, or chronic bronchitis? Right. This is Appalachia. Note how much of Ohio is in this region. Appalachia statistically has high rates of obesity, respiratory disease, cardiovascular disease, stroke, diabetes, cancer, addiction, mental health disorders, and suicide. Many of the linked health disparities are geographical or socioeconomic factors. In turn, Appalachians have a lower life expectancy. Compare these two maps. 32 of 88 Ohio's counties are considered Appalachia. 30 of those 32 counties have the highest percentage of obstructive pulmonary disease in the state. Now on the right side map, you see only counties number 7 and number 19 report lower obstructive pulmonary disease rates that are from 7.3 to 8.6%. The multicolored Appalachian map is from Wikipedia. I never believed in my whole career that I would use Wikipedia as reference material, but it had by far the best Appalachian maps. This map displayed on the right side is the same map that's on the right side of the previous slide. This is the Genesis service area. Licking, Knox, and Fairfield counties are within the Genesis service area, but are not considered Appalachia. Weston, Tuscarawas, and Southern Holmes counties are deemed Appalachia and are part of the Genesis service area, but Genesis does not currently have any outpatient or emergency service locations within those counties. I've again zoomed in even closer on the same map to show you the service area we cover. Our patient population is diverse, but all of it can be impacted by COPD. As a nurse, you are often the first and the last person to see our patients and their families during a visit. You are a resource for people that we serve in all 10 counties. Now, please join me in welcoming Dr. Danny Abu Abdallah. He is quadruple board certified in internal medicine, pulmonology, critical care medicine, and sleep medicine. Dr. Danny completed his medical residency at the Cleveland Clinic, where he developed a love of Ohio and for the Cleveland Indians. From Cleveland, Dr. Danny traveled to Syracuse to Upstate Medical University of New York for his pulmonary critical care fellowship. He returned to Ohio for baseball and to attend a sleep disorders fellowship at the University of Toledo Sleep Disorder Center. We have been privileged to have Dr. Danny on our staff since 2018. Please welcome Dr. Danny. COPD is a multi-component disease. It both physically and psychologically impacts sufferers. Now our second speaker. I'd like to introduce you to Rob Williamson. Rob is a transitional COPD navigator. He sees both in and out patients. He graduated with his BSN and MSN from Ohio University. Rob is a CCRN and a CTTS, a Certified Tobacco Treatment Specialist. He's also an American Lung Association, Freedom from Smoking, and Better Breathers Club facilitator. Please welcome Rob Williamson. Genesis reported in December 2022 585 inpatient admissions for the pulmonary service-related admissions. 178 of those patients were readmissions. All but 44 of the 178 were COPD exacerbations. The non-COPD exacerbations were one asthma exacerbation, one shared patient of tracheobronchial stenosis shared with ENT, 6 patients with restrictive airway disease, 1 with an inhalation injury, 3 were cases of children that regularly follow a pulmonologist, and 12 additional admissions for various respiratory purposes, and 20 required pulmonary critical care services with intubation. Please make a side note that pneumonia is categorized as medicine for this chart, and COPD being readmitted under another diagnosis or disorder are still categorized as readmissions. Based on the number of patients and length of stay and average charges, lung diseases take a toll on our organization. In 2022, nearly 22% of patients will come to the ER or be readmitted within 30 days of hospital discharge. This is a call to action for bedside nurses. You are often the first and last person that patient sees, whether an inpatient or an outpatient. In an effort to better promote health, the Appalachia Regional Commission has repainted barns. The third barn is actually a picture of a barn in Alaska. With perseverance, maybe Ohio's COPD rate will match Alaska's 25,000 people. I want to thank you for participating today. There will be a question and answers on Zoom. You will also be required to complete a few questions in a survey to receive ONA credit. The link to the questions is provided after the Q&A. If you're watching in Simpler Learning, you can direct email questions and comments to me at dowens@genesishcs.org. Thank you and have a good day.